In this session, I want to say a little bit about the various EMDR protocols that exist. So since EMDR was developed in around 1989 or so, there have been many different protocols that different clinicians have created, adapting from that original 8-phase model. So we know that we can use EMDR to treat a variety of different conditions, including, of course, trauma and various types of trauma. We have protocols for different types of anxiety disorders. So there's protocols specifically, for instance, for OCD or specific phobias. There's treatment modifications that have been written about for depression, for addiction, for eating disorders, and just about any condition that you can imagine, really. I'm always so surprised when I look up a different condition and I see that at least a couple of clinicians have adapted that original 8-phase model in some way or another. So it would be way too exhaustive for me to list out what these different protocols are, but I'm going to include a list of some of the more common ones in the references section that you're going to have access to as a part of this EMDR series. Something I want to alert your attention to within the context of trauma, though, is just to know that there are a lot of different ways of doing EMDR, even when we're just working with trauma. So for instance, we have different protocols for children or for adolescents, even different protocols for very young children versus children that are, for instance, 10 or 12 years old. We also have modifications for those who have suffered from sexual violence as opposed to first responders. There's even protocols out there that exist for trauma that is ongoing. So instead of it being in the past, maybe it continues to happen in the present and in the future, such as in the case of first responders. And there is types of EMDR protocols that focus on elements of debriefing, or when a traumatic event has just happened in the very recent past. So there's all sorts of modifications that exist. Generally speaking, when you are looking at different protocol modifications, here's what you're going to look for. So you want to look for EMDR protocols that share some common active ingredients. So here we're thinking about mechanisms. So kind of thinking about what makes EMDR effective. What are the key ingredients that need to be there for EMDR to work? So we want to be both true to EMDR and make sure we're always including those active ingredients, but at the same time, we want to be client-centered, which is why all of these modifications exist for different types of conditions and different types of populations. So some of the key things we're going to look for in these protocols. One is an emphasis on stabilization and resourcing. So what this looks like can be very different with children versus adults or in different types of conditions, but it should always include some sort of resourcing or stabilization. Another piece of EMDR that should always be included is exposure. At the root, really, EMDR is an exposure therapy, right? So we're looking at repeated exposure to distressing material. So that exposure piece will always be a part of EMDR. Because remember, in order to shift a network, you have to first activate it. So avoidance, we know avoidance doesn't work. We have to activate these networks. Another key piece to all of these EMDR protocols is going to be the application of BLS. Now, different protocols encourage different types of BLS. So sometimes it might be the tactile stimulation using something called the TheraTapper. It might be eye movements. It might be eye movements using a light bar. It also might be BLS using audio stimulation. So there's all sorts of different ways we can do this, but we know that EMDR has to include some type of BLS. Also, we're always integrating something positive in EMDR. So all the protocols are going to include that as well, at least as an option. So we don't stop at desensitization. It's equally as important that we integrate positive adaptive material into those previously traumatic networks. So just about every EMDR protocol that you read about is going to have that element as well. So these are what we believe to be the active ingredients of EMDR that we want to make sure we stay true to the best of our abilities. Keep in mind also, as you're looking at different protocols, that most of these protocols have not been researched extensively. Now, a few have, but most of them haven't, meaning there's not a whole lot of randomized clinical trials for a lot of these protocols. So you could make the argument that they're evidence-informed, but most of them aren't really evidence-based, really in the classic sense of the term. However, it is useful, I think, to keep in mind that according to the American Psychological Association, when we're conducting evidence-based therapies, when we're trying to apply these with clients, to truly be evidence-based, you also have to be client-centered. And so I take that as an indication that we should feel free and encouraged to make these modifications to EMDR that best suit the needs of our client while also staying true to those active ingredients of the classic model.